More now on fears that new spikes of coronavirus could be missed because the government has prioritised testing in certain areas. Public health experts say they are worried about a shortage of drive-through tests in some areas and that people are being asked to drive more than 100 miles for a swab. The Health Secretary, Matt Hancock, has announced details, meanwhile, of a £500 million fund to trial a 20-minute saliva test for the virus, which he says will boost capacity. Well, I'm joined now by Dr. Bharat Pankhania, a senior clinical lecturer at the University of Exeter Medical School with more than 20 years' experience in communicable disease control and infectious disease management. Very good to have you with us as ever. Let's look at the key lines from today. First of all, this idea that the testing capabilities, as they are being focused on areas where there are higher rates of coronavirus at the moment, leaving other areas perhaps shorter of tests. I mean, what issues will that give rise to, do you think? Or is that a sensible way to allocate the resources that are available?
I think it is a clear example of we are failing. We are failing to have created the capacity to test extensively. Full stop. It is a failing. Because if you are not looking for cases where you should be looking and where it may be occurring, especially now that the schools have opened, then we are blinded. In other words, we don't know if our case numbers are going up. And therefore, we are only focusing in a place where it is known that the case numbers are up. In other words, we are firefighting rather than proactively looking for where the case numbers are going up, then doing something about it, i.e. identify, find the contacts, remove both of them out of circulation. We are unable to do it if we are not extensively testing. This is very disappointing.
So it's all about getting ahead of the virus where it's on the rise. The Health Secretary this morning said, though, that most people are still able to get a test quickly and to get a test close to where they live.
Well, this is a selected sample of people who are being tested. That is another thing I have been talking about for a long time, which is only people who can get a test by booking it online. In other words, they are internet savvy and have got a car and can drive to a drive-in test center. What we should have done, we should still be doing, is put the test centers where the public are, in the car park of a large GP practice or in the high street where a random sample of our people are, and that will give us the eyes, the ears, the intelligence to act early and fast and subdue a rising tide of infections if we were to find it. We are not in that position if we are not doing those things.
Why not? Why hasn't that happened, do you think?
I wish I knew. I think this has been the gamble of centralizing and asking private laboratories to set it up. These are the consequences of that gamble, to be honest. Because if at the early stage we had said to all our NHS labs, I want you to create the testing facilities as well as our university labs, as well as bring on the private labs, then we would have had many more labs able to do lots more tests. Instead, we decided to go on one focused private provider of tests. This is the gamble.
Just one more question, if I may. The Health Secretary also talking this morning about this £500 million fund to trial new tests, including a 20-minute saliva test for the virus. Something that could be turned around as quickly as that. What sort of difference would that make, especially as we go into the winter, children back to school? I mean, the Health Secretary said weeks and months ahead. He wouldn't be more specific about when it would be more widely available.
So I remember talking about this 2 months ago, and I'm disappointed that it hasn't already come online, because this is a special test. They call it RT-LAMP, technical term, but it is a quick turnaround. It may not be as accurate as the RT-PCR test that we have, but it is still a pretty good idea of what I was calling the rising tide of cases. So this salivary test could also be set up in the high streets, in easier to access places, because it doesn't need complicated laboratory or laboratory staff to do it. We should have done this a little while ago.
OK, Dr. Bharat Pankhania, thank you as ever, Senior Clinical Lecturer at University of Exeter Medical School.